Hi everyone, welcome back to my channel. Today I'm going through some CPCE practice questions for counseling and helping relationships. Feel free to pause this video whenever you need to or listen to it at whatever speed helps best. A client tells the counselor, "I always mess things up. Nothing I do is ever good enough." Which of the following counselor responses best reflects the use of cognitive behavioral techniques? A. It sounds like you're feeling really discouraged and hopeless right now. B. Can you identify the evidence that supports or contradicts that belief? C. Tell me more about when you first started to feel this way. Or D. You're not a failure. You've done many good things. And the correct answer is B. Can you identify the evidence that supports or contradicts that belief? Cognitive behavioral therapy, or CBT, focuses on helping clients identify, challenge, and reframe cognitive distortions. Asking the client to evaluate evidence is a core CBT technique aimed at promoting more balanced thinking. A reflects an empathetic, person-centered response, not CBT specific. C may align with psychodynamic or insight-oriented approaches. And D is a well-intentioned reassurance, but not a CBT intervention. A counselor notices that a client frequently arrives late to sessions and speaks vaguely about their goals for counseling. The counselor decides to explore the client's behavior using motivational interviewing. Which of the following responses best reflects this approach? A. You need to start showing up on time if you want counseling to be effective. B. Let's set firm goals today so we can move forward with a clear plan. C. It seems like part of you wants to make a change, but another part is hesitant. Can we talk more about that? Or D. If you're not committed to this process, maybe it's not the right time for counseling. And the correct answer is C. It seems like part of you wants to make a change, but another part is hesitant. Can we talk more about that? This response reflects a core principle of motivational interviewing, abbreviated MI, exploring ambivalence and evoking change talk in a non-judgmental, client-centered way. MI helps clients work through mixed feelings and develop internal motivation for change. A is directive and confrontational, which can cause resistance. B skips the essential MI step of resolving ambivalence. And D may shut down engagement rather than build rapport. A client in counseling for anxiety states, "I can't go to social events because everyone will think I'm awkward." The counselor replies, "You've mentioned this fear before. What's the worst that could happen if someone did think that?" This intervention is an example of A. Reframing. B. Empathic reflection. C. Socratic questioning. Or D. Paradoxical intention. And the correct answer is C. Socratic questioning. Socratic questioning is a cognitive behavioral technique used to help clients examine the validity of their thoughts by asking open-ended, reflective questions. It encourages critical thinking and cognitive restructuring. A. Reframing involves offering a new perspective, but not necessarily through the client's own reasoning. B. Empathic reflection restates or mirrors emotion to show understanding. D. Paradoxical intention involves encouraging the client to do or exaggerate the feared behavior. This technique is not used here. During a session, a counselor notices that a client begins to speak in a softer tone, avoids eye contact, and crosses their arms when discussing their family. The counselor responds, "I noticed your voice got quieter and your posture changed when you mentioned your parents. What do you think that might be about?" This response is an example of A. Interpretation, B. Confrontation, C. Attending behavior, or D. Immediacy. And the answer is D. Immediacy. Immediacy involves the counselor bringing attention to what is happening in the moment, particularly within the session, including the client's nonverbal behaviors or emotional shifts. It helps deepen the therapeutic process and increases client self-awareness. A, which was interpretation, involves offering a hypothesis about unconscious meaning, not just observing. B, confrontation, challenges inconsistencies or contradictions, usually more directly. And C, attending behavior, includes active listening and body language, but doesn't involve naming in the moment process. A client says, "I just want everyone to be happy with me, even if it means I have to hide how I really feel." The counselor responds, "It sounds like you often prioritize others' needs over your own. How has that affected you?" This intervention is most consistent with which theoretical approach? A, Gestalt therapy. B, person-centered therapy. C, Adlerian therapy. Or D, rational emotive behavior therapy, REBT. So what do you think? Well, the answer is C, Adlerian therapy. Adlerian therapy emphasizes understanding the individual within their social context, including early family experiences and patterns like striving for significance and avoiding inferiority. This intervention highlights the client's lifestyle pattern, like people-pleasing, and invites reflection on how it affects their functioning. A, which was Gestalt therapy, would focus more on present moment awareness and experiential techniques. B, which was person-centered therapy, emphasizes unconditional positive regard and reflective listening, but would be less directive in interpretation. D, which was REBT, would challenge the irrational belief directly rather than explore its impact reflectively. Thank you so much for watching this video. Please like it if you found it helpful, and comment below to let me know how you did on these practice questions. Also, don't forget to subscribe and hit the bell for notifications so that you don't miss when I post new videos like this. I have a whole playlist of review videos for the CPCE, so if that's what you're studying for, check that out. And best of luck on your journey towards becoming a therapist.